Stacey, Conroy.
Patrick.
What up?
Everything above my head.
Yes, that is true. What
Yes.
down? Everything below your head. Right?
Well, I think everything below my feet. I'm claiming my own space from head
You're
to
claiming
toe.
your own space? Okay.
Yeah, it's Stacey's world.
Stacey's world is
Yes.
between her head and toes.
You can only come in with an invitation.
Yeah.
And sometimes it's a Halloween Horror Night event.
Mhm. There you go.
Yeah.
Okay.
So,
Well, let's see what's going on for people today. Jefferson says he went to see a counselor today and told them everything that you have obsessive, intrusive thoughts, images, and urges and compulsions. He said, I don't have OCD, but severe anxiety. Should get a second opinion. I would. I mean, if that person says it's also not OCD, then, maybe there's a third opinion, or maybe the things that you're qualifying as obsessions and compulsions are not. I don't know, right? It's hard to say. Some people, like, I was having this discussion earlier today, Stacey, tell me what you think. You could say that a phobia can sound like OCD, right? Because you have an extreme fear of it and you do all these things to mitigate it. But usually, like with the fear of elevators, once you know that you're not going to be on an elevator, you're not really thinking about the elevator anymore, right? And you're not doing things to avoid an elevator, really, until you're presented with an elevator again. Versus OCD, you don't even have to have the thing or the trigger around you because it's happening in your head, right? It's not usually something triggering you externally. It could be, but not always. But you've got that thing going on in your head. So Jefferson, I would get a second opinion, but if you're feeling like talking about what some of the intrusions are and the compulsions are, and you want to let us know some examples, we could also give you some opinions about what we think it could be. We, of course, cannot do therapy on this whole experience here. Though we are licensed therapists, we cannot provide therapy without having a full meeting with you to see what's going on and learn about you and things of that nature.
Yes, there's a little thing called informed consent.
Yes. just a small time. Very important. Very important.
Though, you could also, if there are other aspects about this person that you like, you could challenge them and ask them why specifically they think it's not OCD, and see if that makes sense. Because as Dr. McGrath was saying, there are things that can look and sound like OCD that might not be OCD. But when you're having intrusive thoughts and compulsions and behaviors, if that's truly what's happening, then it would be. And we've both seen people who have been misdiagnosed as not having OCD or having something else that was clearly OCD. I personally work with a number of individuals, even currently, who have had a diagnosis of psychosis, and they do not have psychosis. It is possible to have both of those things, but generally, the people I work with, it was a misdiagnosis based off of their fixed obsessions and the compulsive behaviors that they weren't willing to give up at the time. So you can challenge that individual and see what their thinking is, or you can seek a second opinion.
Excellent. Rebecca says schizotypal personality disorder and OCD both present weird thoughts and weird behaviors. What are the differences? Well, we don't necessarily call them weird, first of all, in the OCD world. And I hope in the schizotypical world, they don't say that as well. As interesting as this may sound, the behaviors in OCD are driven with purpose. And the purpose is to neutralize the obsession. So, and I'm not an expert on schizotypal behavior, so I can't really say too much about that area. I don't know if you have more, Stacey, experience in that realm than I do.
No, not a lot, to be honest.
But I can tell you that once those compulsions are done, there is some relief until those obsessions pop back up again and the cycle goes. And I don't know that schizotypal behavior has a cycle like that where there's some relief from things. I think that as it's rated more to the schizophrenia potential experience, there's some behaviors that may just appear to the outsider as odd or strange or weird, I suppose, and yet may make sense to the person who has the schizotypal and might even be more of an ego syntonic experience versus an ego dystonic experience, meaning that in OCD, these things are very much unwanted. And that might not be so much the case in a schizotypical, I keep saying schizotypal type of experience.
Yeah. And the same is true of psychosis. That's how you can make a differentiation between a true psychosis diagnosis and OCD. Is what is the function of the behavior, and is it ego dystonic or the other one?
Syntonic.
Syntonic, thank you. It's like, because that is a very distinctive thing. Like you said, OCD, the compulsions bring relief. There's a reason behind the behavior.
Abby says, I'm embarrassed that I'm not getting any better. Okay. I have sexual orientation OCD and previously watched same-sex porn and was aroused, sometimes had these same-sex fantasies during a self-pleasure. Am I gay? You want to take that one?
Well, it's a personal question. The answer is maybe you are, maybe you're not.
There we go.
Yeah. So,
but I will say this. Being aroused by something or having a fantasy about something or even something popping in your head while masturbating is not the definition of homosexuality.
No.
Or straight sexuality or bisexuality or trans. That's just not the definition. Yeah. If that was the case, everybody would be everything probably at some point in time in their life.
Yes. So. Well, and just to add in there, there's more than homo or hetero. There's pan, which means you could be romantically or sexually attracted to all types of people. Non-binary, men, women, So the answer is maybe.
Nobody likes that answer.
No, they don't. But, the interesting thing for me, being someone with OCD and a member of the LGBT community, it's just, I have not run into the person yet who has obsessions about being straight.
I have.
You have? Okay.
Yes, I have actually. I have.
Yeah.
I treated a gay couple, and that was a real tough thing for them, was that the person in the couple who had OCD was afraid, what if they were straight? Yep. And it was just as difficult for them as somebody who was straight being afraid of, but what if I'm gay, right? And it would be just as difficult for someone who was bi who would think, what if I'm not, right? I mean, yeah. Yes. So I have treated that.
I have not. And I think it's interesting that the proportion.
Yeah. It was very interesting too, because it was, I won't go into too much detail, but it was something around, with COVID, no one was in the office with anyone. And after COVID, when you had to go into the office, there was an attraction to someone, just thinking somebody was handsome. And then going home to her wife and telling her wife, I think I might have to leave you because I met a male who's attractive, and that must mean that I'm not gay.
Oh, if that's the criteria, then I need to drop out of the community.
Yeah.
I mean, I may be gay or lesbian, but pretty is pretty. I'm sorry.
Yeah. Right.
Yeah.
exactly. So yeah.
Um,
So yeah, I've treated that. Absolutely. That is a thing. It is not only one way by any means whatsoever. Steve says he's having trouble getting over his ex-wife. She's in a new relationship, feels she's gaslighting him. Um, she and she's involved with someone who might be sort of famous. The thing is, your OCD has you replaying where you went wrong in the marriage and that you should not have ever left her. You also can't stop picturing her being with another person. So I'm going to stick to the OCD piece of this, potentially, which is, are there intrusive thoughts, images, and urges? But I'm not hearing of any compulsions. I don't know if you read this, Stacey, and see any compulsions either, actually.
no, I don't either. I'm not seeing the compulsions.
So I don't know if that's OCD. I mean, now, but this is a great opportunity for us, Stacey, to talk about the use of the word obsessed, right?
Yes.
That we could think a lot about someone or something and say we're obsessed with them. And we want to know everything about them and what they're doing or something. I've been accused of this with the band Rush, that people would say I have a bit of a band obsession. Maybe I do. But compulsions are performed to neutralize something, an intrusive thought or image or urge. Now, we could say, is thinking about your ex an intrusive thought, image, or urge? I think it could be, but I don't know that it's a guarantee that it is. If you're trying to figure out what they're doing, who they're with, and everything, then otherwise, anybody who's ever broken up with someone and then is thinking about that person and wondering about them has obsessive compulsive disorder.
Yes.
Which I don't think you or I believe would be the case.
No, but you bring up a very good point in terms of the word obsession, because you do not want to relieve yourself of the accused obsession of Rush. Something similar happens with the use of the term addiction. And people say, I'm addicted to chocolate.
Oh my, I'm so glad you brought this up.
Yes.
This is a great conversation.
Yes. I'm like, no, you are not addicted to chocolate, okay? You're not selling things to get chocolate. You're not lying. Well, you might lie about how much you eat. I don't know.
You might steal it too, but
You might steal it, but I use the term, fond of or fandom. Like people say, oh, you're addicted to football. I'm like, no, I'm not. I'm a fan of football. I might be a fanatic about football, but I am not addicted to football. So those terms matter. Just like OCD is not a term, is not an adjective. You should not be using that to say, oh, I'm so OCD. My house is so clean. I'm like, yeah, come over to my house. I want you to take care of that in my house. If that makes you happy, fine. But that's not what OCD is. OCD is something unwanted and something that causes distress, disorganization in your life. That's why it's called a disorder. It's not something you want.
Yeah. And compulsion is also important to talk about here, like compulsive shopper, compulsive gambler, compulsive drinker. No. I was disappointed when in the DSM they took away the word impulsive, right? I was kind of like that, actually. But just because somebody does something more than once doesn't mean that it's compulsive.
No.
And the difference between a compulsive, let's say, gambler is when they start gambling, they get a high. There's a joy there. There's oh yeah, this is the time. I've never met anyone with OCD once they start doing compulsions who feels that way. Now, you have OCD, Stacey, so maybe I'm wrong, but tell me, did that ever happen to you when you started to do compulsions that you were like, oh yeah, here we go. This is it now. Awesomeness. Love it.
No.
No. Okay.
No. They were annoying, distracting, took me away from important life activities, events. They took up time. They caused me not to sleep. They interfered with eating. No, they sucked. So you do get a bit of a dopamine reward for anything that hits in the addiction venue, whether that's a behavioral addiction, say to food or to a substance. So although the behavior itself, particularly in addiction, can be repetitive, it's slightly different in how your brain interprets it and the reason behind it. Although I will say with addiction, the behavior of thinking about obtaining and using becomes an all-consuming time involvement. So when people get to the point where they qualify for a substance use disorder, severe diagnosis, sometimes there's actually no pleasure in the activity. You use to feel normal.
Yeah.
And so,
Or just to stop withdrawal, right? And
yeah,
yeah.
yeah.
It becomes like a negative reinforcement at that
Mhm,
point, right? I
yeah,
use to not feel bad.
right.
Mhm. Yeah.
So there's some similarities, but there are also some differences.
Yeah. So when you have both, what a conundrum.
Yeah,
Mhm.
yeah. You know, and the interesting thing is, I read today there's a new study because I go looking for research articles on OCD and SUD, and I found one today that was published late in 2023 out of Sweden. That so even in Sweden, they're finding that individuals who have OCD have a higher uh, chance of having trouble with substances.
Really?
Yep.
Hmm. Interesting.
So, and they looked at like 9,000 people.
Hmm.
So I have to finish reading it, but it looked like a really good study that's going to add to our knowledge.
Hmm. It's fascinating. Hmm. Bert says, sounds simple, but is it all just thoughts? Like if I learn to mark my OCD thoughts and leave them alone, will they disappear over time, even if they are nonstop now? Uh, you're not far off, Bert, in a way. I mean, we talk about learning how to not engage with anywhere that OCD wants you to go with your thoughts, right? No one, no one has ever engaged in OCD thoughts and seen OCD decrease,
No, no,
right?
no way.
So, um, leaving them alone, I like where you're going with that. That's what we're really doing in ERP is we're learning to just kind of accept whatever pops in my head and move on. Not even having to label it as OCD though, like you say. You don't have to mark anything. Oh, well, that's an OCD thought, or no, because that can become compulsive for some people as well too, having to try to figure out which thought is or which thought is not obsessive compulsive disorder. So just being able to be like, okay, all right, whatever, yeah,
Yeah,
naked family member or whatever other weird
or
thing,
whatever. Yeah, but
Yeah.
I think I like the direction he's going too because there is a pattern, and once you can identify the pattern, you can know when it's trying to sneak in your life and switch themes.
Hmm.
You know, if
Hmm.
you don't give it value, but understanding the pattern of OCD, like when it shows up.
Hmm. Blasey says, I have contamination OCD of bodily fluids, but non-infection based, meaning she's not afraid of being sick or dying, just being disgusted with thinking that bodily fluids are on things. What do I do? I'm in ERP. Well, first of all, I was going to say, make sure you're in ERP because that's where you want to go. So you're already doing the right thing. That's wonderful. By the way, tonight brought to you by NoCD, an online platform for the treatment of obsessive compulsive disorder that does ERP, by the way. So check us out at nocd.com. And Now you're talking about sometimes what I lovingly call disgust OCD as cooties, where you know this idea that the essence of something gross or disgusting is is on me, right? But isn't it interesting, Stacey? Usually only if it's been seen. Not always, but the vast majority. Like I was working with someone today who was talking about if he hadn't seen something that he was afraid of touch a couch, he would sit on the couch, even if it had been there, but he hadn't known it. But if he did see it, he would not sit on the couch anymore because now he knows for sure that it's been contaminated. So, is there really an ick factor in the global sense that something being touched by something else can transfer its essence to it and it becomes icky? Or must it be witnessed in order for the ick factor to have actually crossed over to the other thing? Isn't that interesting? I did one of and Stacey, if I've told you this story, let me know. One of my favorite experiments ever was the post-it note experiment that I did.
I have had to have heard this, but I'm not recalling it.
Okay. So someone was at the hospital and had intrusive disgust thoughts, right? And they thought that the cafeteria tables were disgusting. They saw the person cleaning them and they would swish the rag in a bucket of water. They would wring it out. They would come over, they'd wipe the table down. They go to the next table, they'd swish the rag in the bucket of water. They'd wring it out. They'd wipe that table down. And she said, "You're just spreading the germs from table to table by doing that. It's not actually doing anything whatsoever." And I said, "Well, there is soap in there and it does, it does do things, but whatever." So she said that there was absolutely no way that she could touch those tables. They were gross. And that even if she, saw something that was on the table, she wouldn't even want to touch it. And I point blank, I said, "Do you believe that you can detect the disgust from the table?" She said, "I know I can." I said, "Fantastic." I got one of my students and I said, "Write this number," I think I said 14 or something, on a piece of paper. So they wrote it down. I said, "Okay, seal it in an envelope and put it on that chair." Okay. Now I had my student, I said, "Okay, now go in the office, get a package of Post-it notes, and I want you to just put Post-it notes up on this table or on this whiteboard. And what I'm going to do is I'm going to go in the cafeteria. I'm going to touch this finger to the one of the tables in the cafeteria. I'm going to come back and I'm going to touch it to one of the Post-it notes. And that will be the 14th Post-it note because that's the number that we picked. But I want you to just cover this. And then I want you to write down numbers on the Post-it notes from 1 to, I think we had 30 Post-it notes. And once she'd written 14 on it, I went over and I just touched my finger to the 14th Post-it note. And I transferred the disgust from my finger to the Post-it note. So then we had the patient come in and I said, "Okay, here's what I want you to do. I want you to use your power of disgust detection. And I want you to tell me which one of these Post-it notes has been touched by something that was actually in physical contact with the tables in the cafeteria." And so she held her hand over all of them and she said, "It was this one." And she picked like number 27. I said, "Nope, that wasn't it." She's, "All right, I'll try again. This one." Guess what? I got lucky that day. The last one she picked was number 14, was the one that had actually been contaminated. And I said, "I do this not out of anything other than to prove one point to you, which is you have been lied to by OCD, which tells you that you have the power to detect these things and know these things, when the reality is that is not at all the case. And OCD does not tell you the truth here."
Seriously?
I know, it's shocking, but it is true, Stacey. And maybe, just maybe, you've experienced this in your own life. I don't think that once in your entire life of OCD that it has told you the truth.
No, and its best friend in my life, SUD, also lied.
Mm-hmm.
So yeah, I had constant lie, 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 and no answer ever satisfied either.
Yeah. Sounds like a Simon and Garfunkel song. Lie, lie, lie. Lie, 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 lie. Lie, lie, lie. Lie, 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 lie. There we go. So,
Yes, you will be the only one singing on any of these webinars. No,
okay, very good.
no.
Well, maybe someone in the audience found my singing to be lovely. I hope so. Let's see.
Yes. Oh, maybe it was lovely. I'm just not.
Mhm.
Mine's not lovely. I know mine. Mine is horrible. You
Jefferson
need.
replied to us, by the way, and
Yes.
said, yes, he has intrusive thoughts about his sexual orientation, says that he's straight, and his compulsions are rumination and avoiding. He uses a lot of self reassurance. He used to do some outside compulsions like tapping and wall touching, but now most of the things are mental compulsions. Um, so here's the thing, Jefferson. If any of these thoughts could change anyone in any way, like their orientation, their whatever, their culture, their their religious background. I mean, if that's all that it took, don't you think that we would see everyone in the world doing that whenever they had any doubts about themselves, right? If someone was raised in a certain faith, but then they started doubting it, you know, would we just say to them, "Well, pray more," or do some mental compulsions, and then that will assure you that you will stay in your faith? Well, no, 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 no. That is not at all what we would do or where we would go. So Jefferson, again, I'm going to go back to what we just said. You've been lied to, Jefferson, and you've bought the lie, and the lie is that you're on the precipice of changing orientations unless you tap, touch walls, and ruminate. Those are the only things that will keep you in the orientation that you are. And if you don't do those things, you will fall into a different orientation. Now, when I say that out loud, I hope that everybody hears that and goes, well, that makes no sense. But OCD doesn't want you to say it out loud. OCD doesn't want you to tell anybody else about it because OCD is a conniving jerk who slowly weasels itself in and tries to get you to very gradually believe these things as truths. You know, this is how cults get you. They don't tell you the big secret when they meet you. They say, "Hey, you seem like a really cool person. You know, I bet I got some friends just like you, and we're doing a dinner tonight. You interested in coming out? Just come over, meet some buds, have some dinner." That's how it starts, right? And OCD does that too. Hey, just had an idea. Yeah, just throwing it out there. Maybe, just checking it out. Not a big thing whatsoever. Just thought I'd throw this at you, see what you think. That's where it goes.
It's a very similar conversation to how substances
Tell
invite
us
you in.
more, please.
Yes. Oh, well, alcohol. Oh, now I'm relaxed. Now I can socialize. Oh, now I can ask that person out. Oh, now I can sleep. Oh, now I feel better. I feel nothing.
Mm.
Oh, the thoughts stopped.
Mm-hmm.
Alcohol made my head quiet, which
Yeah.
I got to tell you was fantastic.
Mm-hmm.
Long before I had ever heard the word OCD, uh,
Mm-hmm.
I found alcohol. I
Mm-hmm.
started very early in life, and that's what it was. It was like, ooh, look, this makes things quiet. I don't think. I sleep better.
Mm-hmm.
And it just draws you in and draws you in and draws you in. And it took a while before I figured out I had a full blown substance use disorder, which involved multiple substances by the end.
Mm-hmm.
But it welcomes you in. It's subtle. Oh, I'll take care of your emotions. I'll take care of your intrusive thoughts. I'll take care of your obsessions. I'll take care of your anxiety. I'll take care of your social struggles. I'll take care of everything. Just keep feeding me.
Mm-hmm.
And you know what? Didn't take care of any of those things on a permanent basis, because the minute it wore off, it required me to go back and do it again. And so then you have the obsessions, you have the compulsions, and then you have the substance use to quiet them down for a little bit, but they all come back, and you're just caught in this cycle over and over and over again.
Drug sellers also don't give you a massive dose the first time you try a drug. They give you a little nip, right? And
Well,
just yeah, a little taste.
yeah.
That's not so bad.
And the first one's free.
Yeah, and I can totally control that. That was like nothing, right?
Mm-hmm.
But a few more nips means a little bit more after a few more, and then the nips are bigger and bigger and bigger and bigger until it's more and more and more and more and more, and then you're indebted to that drug dealer, right?
Yes. Well, and one of the things that is important in terms of OCD and SUD that I don't know if you've heard, they're seriously looking to switch marijuana from a Schedule 1 to a Schedule 3
Tell us what that means, please.
drug. Well, a Schedule 1 drug is where marijuana has sat federally for a long time. The DEA and all federal NIH, all federal agencies consider marijuana a Schedule 1 drug, which means it has no medical benefit whatsoever. And that is why there's been, no federal research on marijuana and how it might be beneficial or not. And a Schedule 3 drug means that there is medical utilization for it. And if they change it to a Schedule 3, then we'll probably see studies particularly done on some of the things around marijuana. And I believe that we'll have some studies that show it has some efficacy in certain areas, and those studies will show that it doesn't have efficacy in other areas. But I think the research has been very limited because a Schedule 1 drug, I'll give you an example. Another Schedule 1 drug, heroin. You can get opiates, but you can't get heroin in the United States. There's no medical reason for heroin in the United States. Marijuana as a Schedule 1 drug fell into the same category as heroin.
Interesting.
Yes. So
yet they do use it for glaucoma, so we do know that it has potentially some medical, right?
Yes, well, because states can use it.
Okay.
It's at the federal level.
Okay.
So, somebody once asked why federal prosecutors don't go after people in states, and they said because we'll never get a jury to sit and convict somebody for marijuana. It'd be a waste of our time and money. But there's just been a delay in the federal system following along with several states that approve medical and or recreational marijuana. So the importance in terms of this is that it will make marijuana more accessible to a larger proportion of the population.
Yeah.
And as I've said before, alcohol is legal. Doesn't mean it's safe for everybody. And people have to make their own personal decisions around that. But it's going to be a change. And I think it's probably going to happen either by the end of this year or the beginning of 2025.
That's fascinating. Wow. Interesting.
Yeah. So it's going to be a big shift. And in terms of, people's perceptions of it, alcohol is legal. I work with a lot of people who use alcohol to quiet things down. I used it to quiet things down. But as I said, when you come down, your obsessions are still there. If you don't treat the OCD, then you're putting a Band-Aid on something that's bleeding.
Mm-hmm.
A Band-Aid on a cut that needs stitches.
Mm-hmm.
And That's the problem. It's like you get high because there's no food in the refrigerator, and when you come down, somebody stole your refrigerator.
I hate when people steal my refrigerator.
Yeah.
Drives me nuts. Now, one piece for all of our friends listening. This is a state thing, not a federal, because if you're at the VA and you've got marijuana, you're on federal property. You're not on state property. You've got a whole different world of hurt potentially on you in that kind of case, right?
Yes.
Mm-hmm.
And federal employees who are subject to drug testing can still run into disciplinary issues, even if they have a state medical marijuana card.
Interesting.
Yes. There's implications for multiple professions and individuals. So, and again, people are going to have to be mindful, just like you are with alcohol. If you use something too much or to excess, it becomes a problem. And you may need some help in that. And seeking out treatment for substance use disorder is just as important as getting treatment for your OCD.
Yeah.
And the problem is, we don't have a test that says, oh, you're probably going to develop an addiction. What happens is people get involved in this very innocently. I mean, I didn't know the first time I had a drink and my mind got quiet that I was going to end up going to rehab 7 times. So there's just no way to know. You have to be mindful of what is going on in your life and be honest and listen to the people around you. Sort of like when you have OCD, it doesn't just affect you, it affects the people around you. And when people around you are telling you you might have a problem, whether it's OCD or SUD, then it's time to seek help.
Yeah.
So, and with that said, if you don't know where to find help, we have a website for our special interest group for OCD and SUD, and it's ocdsud.com. And we have a resource page on there. It has self-help books. It has links to treatment locators for OCD and SUD. And it has some resources that you might find beneficial as you're trying to, work through this and get better.
Mm-hmm. Diana says, I definitely noticed my OCD getting worse since the loss of my youngest child, which is, of course, a terrible stressor. And boy, does OCD love a stressor to grab onto. So we're sorry, Diana, for that loss. Your tics are also flaring up. Your anxiety is worse as well. You don't want to leave your house at all. It's hard when you have things to do. And since losing your son so suddenly and violently and tragically, you were also diagnosed with PTSD, panic, and anxiety. Yeah, Diana, as I said, OCD sure loves a stressor, and it will take advantage of any stressor that it possibly can. So now OCD, being the jerk of a disorder is, will do things like, oh, Diana, we can prevent the loss of any of your other children as long as you do these compulsions. Then that will prevent this tragedy from ever happening again. And that's one of the reasons I just really dislike OCD, is because of that kind of messaging that it sends to people, and it leads them to feel guilt and shame and disgust at their own behavior for maybe OCD's right. Maybe I could have done more. Maybe I should have done more. Maybe blah, 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 blah. And no, it's just a real jerk. And that's the kind of stuff that it does.
Yeah. And SUD does something similar in terms of you can't handle your emotions. You need me.
Well, and Diana, in a situation like this too, I think it's important to recognize that the lure of an SUD, along with all of these other things, would be that, oh, but just to quiet my head. This is why people do start drinking after a big stressor like this as well, because they want the quick way to quiet their brain down. And we know in OCD and we know in SUD, quick fixes are not the best fixes by any means whatsoever. It's not the way we want to go.
No. I'm going back a little ways, but somebody asked, how do you differentiate between thoughts from OCD versus SUD? And then
take it.
How do you do them specifically, thoughts about wanting a substance? Well, here's the thing. Both thoughts are unwanted. And so with the OCD, getting treatment, engaging in ERP. But here's the kicker and the thing that makes it complicated. If you engage in ERP, chances are your anxiety is going to go up. And what I just said is SUD tells you you can't handle your emotions. You need me. So it increases the likelihood that you're going to have some thoughts around solving that anxiety through SUD. So OCD says, if you do this, you'll be safe. SUD says, you can't handle your emotions. You need me to get through this. So although there might be slight differences in the thoughts themselves, both of them are unwanted, and the value we give to them is what drives the power they have. I can't say that I never have an intrusive thought. I can't say that I never think about substances. But now I go, oh yeah, that was an interesting thought. What was I doing? So through treatment, I've learned the thought is a thought. I have it. I might think about it for a second, and then I'm able to move on to the things that I want to do in my life. So differentiating between where did this one come from is less important than making sure that you're getting your treatment for both and learning that a thought is a thought. And the thought doesn't itself have power.
You can't live in the world today without thinking about drugs or alcohol. I mean,
no.
There's ads on television. There's ads on billboards. There's themes in movies and TV shows. There's songs about usage. There's no way to avoid this unless you live under a rock. I mean, there's just no way to avoid it.
No. Beer commercials during football, please.
Mm-hmm.
And that's one of the things is like when you're in early recovery from SUD, one of the challenges is that you see it everywhere. You walk by bars, you walk by, liquor stores, you go to the grocery stores. In some states, there's alcohol in the grocery store. You see it on TV. I ran into a real weird situation at one of my jobs because I worked in the SUD community and I was working at a program, and we had somebody come in to teach the people who did not have an SUD history a little bit more about substances. And he happened to be a DEA agent, and he pulled out an inert. They did something to make it inert, but he wanted to show people what a kilo of cocaine looked like. And my brain went, oh my God. I had no idea that was coming. Mm-hmm. And I even went to my boss and said, you do have people who might not tell you they're in recovery on your staff. I tell you I'm in recovery. You should warn us. Mm-hmm. Not because we need to change the training, but my brain responded in a particular way that it's a custom, and nobody has pulled out a kilo of cocaine in front of me.
For a long time. Yeah.
Oh.
Yeah.
And I'm sorry. Do you know what I remember about that training?
The kilo of cocaine.
Bingo.
That's it. Nothing else.
Nothing else.
Yeah.
So, there's that aspect to it. You want to make sure that you realize a thought is a thought is a thought, and the value that we give to it. But learning how to not give it as much authority or power comes from doing ERP, doing some treatment around your SUD. Mm-hmm. It doesn't just happen,
Mm-hmm. I mean, it'd be nice if things just happen, right? But
if I could just say stop it.
Mm-hmm. One of my favorite little idiom things is if someone said it's a Russian proverb. I can't confirm nor deny, but the one that says, if you find yourself in the middle of the ocean in a rowboat, praying is fine, but rowing toward the shore might get you where you're going a lot faster.
Yes.
So
yeah. I actually have a T-shirt that says, "Good things come to those that wait." And right underneath it says, but great things come to those who get off their ass.
There you go. There you go. Yeah, I really like that. That's awesome. Mm-hmm. That's really awesome. Let's see. Was there anything else you wanted to jump onto there?
I'm looking.
Mm-hmm. There are people talking about being terrified of getting certain things. You know what I've never seen in OCD? And I don't know that I ever will.
Oh, I know what this is.
Well, there's one that I use all the time, which is I'm afraid everybody loves me and thinks I'm awesome.
Yeah.
Never treated that one. But I've also never seen, I'm really afraid of just living my life and being out there in the world. In the sense of there are people who are afraid to do that without compulsions, but I've never seen people who just that fear in and of itself is the thing they're afraid of. You know, it's always, I'm afraid of not being able to live my life the way that I want to if this one thing happens, right? And that's really what the presentations seem to be is, what if I can't live my life the way that I want to live my life? But in doing so, guess what happens? You don't actually live the life that you want to live because you spend so much time being afraid of not being able to live the life that you want to live, that you don't live the life that you want to live. I've been fascinated by the number of people I've treated who are afraid of waking up in the middle of the night to go to the bathroom and that it will ruin their sleep, who then stay up all night trying to make sure that they don't have to go to the bathroom and then don't sleep at all. I've treated so many people who have something along those lines that we talk about the very thing that you're afraid of is the thing that you create on a nightly basis.
Mm-hmm.
And wouldn't 6 hours or 4 hours of sleep and then waking up to pee be better than no hours of sleep whatsoever, making sure you don't pee? I mean, you know, but again, don't try to be logical with OCD now, because that's just dumb when you try to be logical. You know what's stupid? Logical OCD. That's what's stupid, because there is no such thing. Yeah.
No, you create a paradox. The very thing that you want is the very thing that you prevent from happening.
Yeah. So I've prevented myself from sleeping all night by worrying about not sleeping all night.
Mm-hmm.
When if I wasn't worried about not sleeping all night, I could at least get some sleep, and that's better than no sleep whatsoever.
Which then allows you to not be exhausted the next day and live the life that you want to live.
Jeez, look at that stupid logic. So,
You know, but that's the thing about OCD and SUD. One of the things is you don't want, you know, somebody at the very beginning of this said, I talked to somebody, I told them all about my obsessions, about my compulsions and all of this, because there's a lot of secrecy involved in both disorders where you don't want to say it out loud. You don't want to say, hey, I'm having these thoughts, or I have this problem with substances. One of the reasons I'm so open about being in recovery from SUD and will share any part of my story with people is because you have to see that recovery is possible. And there's so much shame and secrecy around both of these disorders that it's hard to say these things out loud. And that when you do, you realize that they're not logical, they don't make sense, but yet that's where you are in the moment. And it can be terrifying to share this information that your world is out of control and you're not really sure what to do next.
yeah. Yeah. And then OCD says, well, I can bring your world into control if you just do what I tell you to do.
Mm-hmm.
Isn't that a kick in the teeth as well, too? Mm-hmm.
Yep. And when you get tired of the OCD saying, I can do this, SUD says, and I can shut him up for a few hours. And that was my whole.
Man. I love that. That was the quote of the night right there. Yeah.
Yep.
Yeah.
Yeah.
That's really cool. That's really cool.
I was on that treadmill for over a decade.
Mm-hmm.
0 stars, do not recommend.
Mm-hmm. Yeah. Beth says, can OCD be hypnotized out of you? Just a thought. We haven't seen any double-blind, peer-reviewed studies that say that that is the gold standard of treatment as of yet. So, yeah. Wendy says, I'm afraid of getting anything because then I don't want to get it, even just a cold, because that could lead to bad issues in some people. Yep. Mm-hmm. Again, Wendy, you could watch the 1976 classic John Travolta Boy in the Bubble movie where you could do the kind of the reverse. You could live in the bubble to assure that you get nothing so that you will also pass nothing on. However, will you actually be living the life you want to live or the life that OCD wants you to live, if that is the case? Or do you do what all of us do and there's a risk involved in absolutely everything, right? Because Wendy, I'm going to bet you drive, and I'm wondering if you're also afraid of running people over with your car. What would be worse, Wendy? Shaking my hand and giving me a cold, or killing me by running me over with your car? And you know, Stacey, some people will say giving you a cold will be worse.
Yeah, they will. But personally, I think it would be a bummer because, although you can be a sarcastic friend, I would miss you.
I would not miss you because I would be dead, so I wouldn't
Yeah.
know. But I can say now that I'd like to think I would miss you, but I believe I will be dead, so I won't miss you.
Well, yes. I'd much rather give you a cold.
Yeah.
Yeah. But you're right. OCD tells us that, the option that if it has you focused on is the worst thing ever.
That's right. Yeah.
Yep.
Yep. That's it. It'd be worse to give someone a cold than it would be to run them over with your car. Mm-hmm. Yeah. I've even had people try to convince me they're the worst people in the world, and they've never done anything harmful to anyone, but they've had intrusive thoughts about it, which makes them worse than the people in jail who have actually gone and done it as well.
I'm a delightful person, and I've had some terrific intrusive thoughts. So I debunk that theory.
I think one of your intrusive thoughts is you're a delightful person. I mean, because that is not true. You're not. It was good to see you a couple of weeks ago, by the way. It was enjoyable.
Yes.
Mm-hmm.
Yeah. We got to be in the same room for a change.
Yes.
So.
One last question. Matt says, I have OCD in my prayers. Do you have any advice? So we call this scrupulosity, and scrupulosity is about morals or ethics or religion. And we often talk about the fact that maybe it's I have to say a prayer correct or without a mistake or with the right intention or tone or something. If not, it'd be rejected, and then it was worthless, and then I might go to hell or something of that nature. And so we just want people to really be able to recognize that OCD can take even something as precious to you as might be like religion, turn it on its side and say, yeah, but if you don't do this my way, then it'll be bad for you, just so you know. So, Stacey, take us out of here. Fill everybody in on what we do and where we're at.
Well, 2 things. We do OCD, SUD, special interest group through the IOCDF. And we have a website at ocdsud.com. We have a lot of resources on there. And in case you do not know and are able to attend, the International OCD Foundation Conference will be coming up in Orlando, Florida in July of this year. Myself and Patrick will both be attending, and we will be doing a presentation on OCD and SUD with a few of our colleagues. So if you're able to attend, It's a great opportunity to learn a little bit more about OCD. It's for people with OCD, people who treat OCD, and researchers. It is one of the coolest conferences I have ever gone to. There's tracks for individuals, families, and therapists. And so if you're in the Orlando area or can get to the Orlando area, it'd be a great opportunity to learn a little bit more about OCD. You can come find me. I'll be walking around with a big white stick, which means I'm legally blind. And so if you wave at me, it's not going to work.
Right.
Walk
And I will usually be on the other side of that stick being beaten by it. So you will find me as well.
Well, he earns it throughout the year, so I have no guilt. Okay, there's no problem with this. There's no intrusive thought. There's no guilt.
Nothing.
No, it's
And
pure joy.
tonight has been brought to you by NoCD. Check us out at nocd.com for all of your OCD and related condition needs. We do work with OCD and BFRBs and tics and hoarding, and we work in the US and Canada and the UK and Australia, and we do take insurance as well too. So please check us out at nocd.com. Thank you, Stacey. Joy as always. We'll see you in a month.